Good evening, friends. Valentine's Day is a special time to share with loved ones and enjoy the finer things in life. One of tonight's finer things in life is your joining the fight against cardiovascular disease. Your participation tonight ensures that the patients at Pepin Heart receive a much higher standard of care. The $500,000 raised to date from our Pepin Heart Valentine Galas have purchased state-of-the-art equipment that allows us to provide excellence in healthcare through advanced technology. Tonight, you're purchasing a 3D echo machine. Three-dimensional echocardiography is a very significant technological advancement that can now detect holes in the heart, problems with valves, and irregularities in muscle contraction and blood flow. Showing high-definition images of a patient's heart in motion helps physicians diagnose prior to a procedure and receive immediate feedback during a procedure. Heart disease is the leading cause of death in the United States for both men and women. Heart disease kills 3 times more people than the number 2 killer, cancer, and kills 7 to 10 times more women than cancer. Florida's aging demographics put us at the epicenter of cardiovascular disease. The proliferation of this deadly disease is compounded by obesity and diabetic factors. With over 22 years' experience, Pepin Heart is one of the highest patient volume heart hospitals in the nation. And at the same time, we're being showcased as one of the best standalone facilities in the nation. We're an intelligent, all-digital facility. Real-time information in the hands of physicians and clinicians at the bedside. We're the region's high-end provider, the Moffitt of cardiac care. The rising cost of heart disease will soon cripple the healthcare industry unless we move from treatment to early detection and prevention. Our budding cardiology teaching partnership with the USF Health is positioning us for another quantum leap, similar to what Total Cancer Care has done for Moffitt. In the near future, you'll be hearing of all the great collaborative work we're doing with USF Health in the fields of personalized and preventative medicine through genetic marking. We will also be leading the charge in biotech regenerative medicine. We're currently involved with 28 clinical research trials, collaborating with institutions such as Mayo Clinic, Moffitt, Cleveland Clinic, University of Florida, Harvard, Duke, Miami, Vanderbilt, Yale. The list goes on. We've received multiple national awards for research excellence, and we can boast an active publication record. As you can see, I'm very passionate about our purpose, as is everyone at Pepin Heart. Cardiovascular health is one of the greatest gifts my family can give to our community. And I thank you for being here tonight to support the efforts of Pepin Heart.
Good evening. I'm John Harding, President and CEO of Florida Hospital Tampa Bay Division. We're delighted you're here on this wonderful night that celebrates the heart. In ancient times, the belief was that the heart was not only a physical organ, it was the center of the emotions. Every day at Florida Hospital, we work to heal the physical heart through cutting-edge technology, research, physicians, and staff. And we work to heal the emotional and spiritual side of our patients. I wish everyone in this room could witness the dedication, compassion, and commitment of the Pepin Heart team, whose amazing work saves lives every day. Thank you for your generous support as we continue elevating healthcare in Tampa Bay through the incredible work at the Florida Hospital Pepin Heart Institute.
I was in Gatlinburg on vacation with my dad and my family, and we were hiking, and my dad and I decided to race up a mountain, and at the top, I had to bend over, and my heart was beating unusually fast, and I started feeling really faint, and it just seemed unusual that something like that would have made me feel like that. My mom and I called the doctor, so it took like 5 minutes as a hole in the heart, which is technically atrial septal defect, and basically said it had to be closed immediately.
If left untreated, usually this leads to congestive heart failure. Fortunately, it was diagnosed at an early stage when she started developing shortness of breath on minimal exertion. What we did was we were able to close the big hole in her heart called the atrial septal defect without surgical therapy. It's what we call as a percutaneous atrial septal defect closure using the new devices we use.
If she didn't get this procedure done, and if I couldn't convince her that it had to be done and that she had to stop playing soccer, and we had to do this immediately, I knew it was life-threatening.
Percutaneous repair or non-surgical repair of atrial septal defect is just a first step. With Pepin's support and the community support down the line, in 2 months, we will be able to offer percutaneous or non-surgical repair of aortic valve. This will be unparalleled to the other hospitals in the area.
So I have to say thank you to the people who invested the money to build this heart center. I have to, because they saved my daughter's life.
I was actually training for a triathlon, knowing that I have risk factors for heart disease. And much to my surprise, on a Saturday morning, I began to have chest pain while playing basketball. Because the pain continued, it was more of a discomfort more than a pain. I elected to call my friend and cardiologist, Jim Smith.
I was not on call. My beeper was not even on, and I could hear it vibrating ever so slightly on my bedside table. I was up and I just kind of went over and picked it up, and it was Bob on the phone. He explained that he was having some chest symptoms, and we talked together. He was just a couple of blocks away from our sister hospital in Carrollwood.
After arriving there, realizing that I was having a heart attack, I was very pleased that they were instrumental in caring for me at that time.
And within just a few minutes of my arrival there, he developed a rhythm that is, in the field, a fatal rhythm. Had that happened on the basketball court, unless there was somebody there to do CPR on him, it would have been all over. And it's not a nice thing to be talking to your friend and then see their eyes just float off into space and get that sense of the soul is just exiting at that point. He developed ventricular fibrillation, and I had to defibrillate him.
Circumstances which could have obviously been to my consequences of dying if I had not been in that situation.
Shortly thereafter, the emergency room doc over there in Carrollwood precipitated the process that brought an ambulance over, and we moved through traffic to get here. We got here, dashed into the cath lab, were able to do our procedure very rapidly.
I'm happy to say that because of that, my heart is performing fine. I was able to indeed participate in a half marathon just last weekend, so I'm very grateful for the intervention of Dr. Smith, the Pepin Heart Center. Without their intervention, I wouldn't be here.
I performed the first coronary angiogram at this institution 22 years ago. But the important fact is that at that time, a group of visionary cardiologists and internists felt that we could provide optimal care to our patients with cardiovascular diseases. Indeed, 22 years later, the expectations have been realized. We can now provide the spectrum of cardiac care and interventions for patients with heart and peripheral arterial diseases.
We are so proud of this facility and the standard of care that we provide at Pepin Heart. The technological advances that are practiced in this facility, the standard of care for the patients is the best, not only in the Tampa Bay area, but probably in all of the state of Florida.
The cardiovascular disease is one of the #1 killers, and it's increased dramatically in women. And we see about 15 ST elevation MIs every month, which is basically our easy to diagnose heart attacks. And those patients dramatically benefit from the environment that Pepin has of rapid treatment of these patients, because there's no argument that the faster you treat these patients in an appropriate way with cardiac catheterization and angioplasty, those patients do dramatically better as far as their survivability and their outcomes.
The Pepin Heart Institute has some of the best clinicians in heart care. We continuously strive for quality and excellence, as evidenced by our patient satisfaction scores, which are in the 97th percentile. We have the passion for high quality patient care.
Pepin Heart attained chest pain accreditation in 2004 from the Association of Chest Pain Centers. And we were one of the first hospitals in all of Florida to achieve that accreditation. And then we went on and were reaccredited in 2007 and 2010 as a chest pain treating center.
At Pepin Heart, we are focused on patient outcomes so that we can focus on our institution being the best place for patients, where they can be assured that they would get the best possible result from whatever procedure they might have to have.
In terms of treatment of atrial fibrillation, we have the latest three-dimensional mapping tools, and one of only 2 hospitals in the area having the cryoballoon technology, which is the latest treatment for atrial fibrillation. And I've been bringing patients from hundreds of miles away to have this therapy here.
Pepin Heart Hospital is an amazing place. You just have to walk other doctors through here from other facilities, and you see the jealousy in their faces. It's incredible. It's a very high-tech institution. We're on the cutting edge of cardiovascular medicine, whether it be the things go on here in our cath lab with stenting or closures of holes in people's hearts, whether it take place on the 3rd floor in this building, whether it's endovascular aneurysm repair, some of the incredible things we do with arrhythmia surgery and valve surgery. We're the only institution in Tampa presently doing minimally invasive valve surgery, and now we're embarking on a new horizon of percutaneous valve surgery.
I have been very blessed to be associated with an institution like Pepin Heart. Imagine how many times you have witnessed, seen in the emergency room where a patient comes, where the family is not sure if he's going to be able to go home, and lo and behold, with the intervention and involvement, we are able to send this patient sometimes as early as 24 hours and in a much better way than what he came in. Lives saved here are incredible. The values it brings is priceless, and I believe that the continued support from people like you is fueling this and allowing the institution to able to deliver the world-class care to every patient that comes here.
Through the very diligent and hard work of the staff here, and particularly Bridget Shaw, we were able to come up with the Pepin Heart Hospital, and through the generous donations of the Pepin family and their friends, we have this gorgeous building that we get to operate in.
The Pepin Heart Institute, and especially what's in store in the future with the Adventist Health System and our partners in Orlando in particular, is, I think, going to be spectacular. What we've done in the past is really unparalleled, and I'm not embellishing this. This is the truth, not only in the Tampa Bay region, but in the state of Florida and elsewhere. And it's largely because of the support of the people here, both on the community level, the physicians here, and even the patients here. The sky's the limit in the future, and we have the Pepin family and others to thank for that.
Mr. Tom Pepin has not only stepped into his shoes, but far exceeded his father in his support for the facility, support for all the research that we do here, and if nothing less, the encouragement that he provides and pushes us forward to do a better job each and every day.
What if you didn't have to decide between a hospital with great personalized care and an academic medical center? What if you had both? That would be transformational to the community. Well, that's what's happening with the USF Health and Pepin Heart Hospital at Florida Hospital Tampa partnership. you will be able to have the best of academic care with all the up-to-date research, with the kind of patient-centered care that exists today in Pepin Heart Hospital. It will be a one-of-a-kind partnership that doesn't exist anyplace else in the Southeast. Not only that, we're going to be looking at each patient as an individual, getting down to the genome and making sure that you're getting the right prevention, diagnosis, and treatment for you, not just for folks that look like you. So this is going to be a very, very, very exciting time for all of us who have a heart in making sure that we stay heart healthy in this partnership between USF Health and Pepin Heart Hospital.
Good evening. I'm Bridget Shaw, the Chief Operating Officer of Florida Hospital Pepin Heart Institute. As you have just seen, heart disease affects everyone, no matter the age, the gender, or occupation. As a matter of fact, heart disease kills more women than men in this country today. Every 75 seconds, a woman dies from heart disease. That's why we are launching a new program called Heart Caring that focuses on women's heart health issues. Our research and clinical experts keep Pepin Heart on the cutting edge of heart care, so patients like Christy have the chance for fulfilling and productive life. Together, we will win the battle against heart disease. As always, I want to applaud all of our physicians and clinicians for saving the hearts of Tampa Bay. Have a wonderful evening, and thank you for your continued support.